I don't know if it's creative, but it's interesting, at least to me, and I'll tell you, it certainly was this morning with my household, my 4 kids, that, and excuse them and forgive me, seemed more intrigued by this slide that we were working on than anything else related to this pandemic, because of their love for animals. We have 2 gorillas at the San Diego Zoo that now have tested positive for COVID-19. 2 that have been tested positive. We have another that's symptomatic. We're currently confirming the source of the infection and the strain. There is some question, did it come human to animal? That's being determined, and one has to respect that process and the adjudication of the facts. But nonetheless, it's just an area that's long been of concern, human to animal transmission, but our beloved gorillas, obviously, we are concerned about, and San Diego Zoo, best of the best. They've tested now formally 2 positive, but 3 are symptomatic, and we are likely to see more information about this in real time in the next hours, not just days. But I thought I'd just bring it up because, as I say often to all of you, what tends to resonate in my house, I want to make public to you in real time, and that's the update in terms of the status of these gorillas in the San Diego Zoo. So
from the basement.
CNN anchor Chris Cuomo is out of quarantine, recovered from COVID-19, and reunited with his family.
This is the dream, just to be back up here doing normal things.
Cuomo's 17-year-old daughter Bella has been taking care of the family.
My dad has corona, but he's going to be okay. He's actually doing really well right now.
And showed off the hazmat suit she used when checking on her dad.
Is that okay so far? My name is Rochelle Walensky, and I am the director of the Centers for Disease Control and Prevention.
How do we get this pandemic under control?
We have to mask, we have to socially distance, we have to wash our hands, we have to avoid crowds, avoid travel, and then we have to get vaccinated when we can.
Explain the COVID mutations and how we stop them.
So when viruses mutate, they can make mistakes when they replicate, and when they replicate and make mistakes, sometimes they have some advantage to the virus. So the new variants are just like the old variants in terms of the disease. However, they may be less forgiving. So if there was a mask breach before that might not have caused disease, it might this time. So we just have to do the exact same things.
If someone has had COVID-19, should they still get the vaccination?
It's likely if you've had COVID-19 before, you still have some immune protection up to at least about 90 days. So yes, you're eligible for vaccination, but we might ask that you consider waiting so that others who don't have any immunity could get vaccinated before you.
Will we need to retake the vaccine every so often?
We don't have data on that yet. The vaccine trials are looking out to 2 years, and so those data will be forthcoming, and as soon as we have them, we'll let the public know.
Are we on track to administer 100 million shots in the first 100 days?
We are absolutely on track. We have been working really hard. At day 100, we're not done. We still have 200 million more Americans that we need to get vaccinated, and that track record will continue.
What's the biggest COVID-19 myth that you would like to get rid of right now?
That masking doesn't work. Okay, awesome. Okay. Thank you for that question. Thank you for the conversation we had, and I'm very sorry it appeared like it wasn't urgent to me. I'm the mother of 3, one of whom has been home for this entire year. This is an urgent issue. I understand the mental health challenges. I understand the educational challenges, this food insecurity. This is urgent. Please don't get me wrong. This is urgent. There was a study out of Wisconsin that demonstrated in schools that in a time of high disease prevalence, that with 92% mask wearing and de-densification of classrooms, somewhere between 11 and 20 students, we could get students back to school safely. There's also a similar study from Georgia that showed without masking and without the proper mitigation strategies, there were outbreaks in 9 elementary schools. So our guidance was intended to lean in. We specifically articulated as it was released that schools that were doing well, we wanted to, and were open, we wanted to keep open. And so as we released this guidance several weeks ago, it was intended for schools to lean in, for schools that were clamped shut, to use this guidance to decide what mitigation strategies they needed to do, recognizing that the MMWR that we reported several weeks ago, 60% of students were wearing masks in classrooms. We needed to get those numbers up if this was going to be done safely, and this was the roadmap to do so. On the question of 3 feet and 6 feet, we looked for science to determine what was the proper distance on the question of 3 feet and 6 feet. At the time, you may recall, there were about 250,000 cases per day, and much of our communities were in a very high rates of community spread. We agree on the science that the spread was happening less so in the schools than in the community, but if mask wearing was happening, we were seeing breakouts, and we had science for that. Just last Thursday, I believe, there was a study out of CID from Massachusetts in a place where there was about 100% mask wearing, that 3 feet and 6 feet yielded the same amount of infections. And so that was the first study we had seen that looked at 3 feet versus 6 feet. Indeed, because 6 feet has been such a challenge, science has leaned in, and there are now emerging studies on the question between 3 feet and 6 feet. I'm aware of several that will be released in the next several days, and we are actively looking at our guidance to update it.
For the record, that masks are not theater, masks are protective, and we have immunity there. First of all, when you have a variant, you have an immunity that you get what's convalescent sera and the same sort of thing. If I vaccinate you or me against the wild type, you get a certain level of antibody that's specific for a particular viral strain. If there's a circulating variant, you don't necessarily have it. You have some spillover immunity to be sure, but you diminish by anywhere from 2 to 8-fold the protection. So the point I'm saying is that there are variants in now circulating. The point that Senator Paul was making was that if you look at wild type only, there is some clear-cut credence to what he's saying. But we are living right now in a situation where we're having a dominance of 117, which was the original UK. We have a very troublesome variant in New York City, a 526. We've got 2 variants in California, a 427, 429, and we have a number of others. So we're not dealing with a static situation of the same virus.
While we increase vaccinations, we're going to take steps necessary now to slow the spread of the disease as well. One of our 100-day challenges is asking the American people to mask up for the first 100 days, the next 99 days. The masks have become a partisan issue, unfortunately, but it's a patriotic act. But for a few months to wear a mask, no vaccines, the fact is that they're the single best thing we can do. They're even more important than the vaccines because they take time to work. And if we do this as Americans, the experts say by wearing a mask from now until April, we'd save more than 50,000 lives going forward, 50,000 lives. So I'm asking every American to mask up for the next 100 days. Yesterday, I signed an executive action that requires mask and social distancing on federal property. Today, we'll be signing an additional executive action to extend masking requirements on interstate travel, like on trains, planes, and buses. And in light of the new COVID variants that you're learning about, we are instituting now a new measure for individuals flying into the United States from other countries. In addition to wearing masks, everyone flying to the United States from another country will need to test before they get on that plane, before they depart, and quarantine when they arrive in America. Our national plan launches a full-scale wartime effort to address the supply shortages by ramping up production and protective equipment, syringes, needles, you name it. And when I say wartime, people kind of look at me like wartime. Well, as I said last night, 400,000 Americans have died. That's more than have died in all of World War II. 400,000. This is a wartime undertaking. Today, I'm signing an executive action to use the Defense Production Act and all other available authorities to direct all federal agencies and private industry to accelerate the making of everything that's needed to protect, test, vaccinate, and take care of our people. Well, we've already identified suppliers, and we're working with them to move the plan forward. Now look, our strategy includes a plan to safely reopen schools and businesses while protecting our workers. Today, we're directing the Department of Education and the Department of Health and Human Services to immediately provide schools and communities with clear guidance and resources to safely reopen the schools, and child care centers. We're putting, and by the way, when you do that, think of all the people who can get back to work, be able to get back to work. All the mothers and single fathers are staying home, taking care of their children. We're going to put the full force of the federal government behind expanding testing by launching a COVID-19 pandemic testing board. This effort will ensure that we get testing to where it is needed and where it's needed most, helping schools and businesses reopen safely and protecting the most vulnerable, like those who live in long-term care facilities. And for the millions of workers, many of whom are people of color, immigrants and low-wage workers, who continue to put their lives on the line to keep this country going through the pandemic, I'm calling for the enforcement of more stringent worker safety standards so that you are better protected from this virus while you have to continue to work to protect the rest of us. Our plan also protects those most at risk and works for everyone of all races and urban and rural communities alike. Today, I'm formalizing the Health Equity Task Force that we announced in the transition, led by the brilliant Dr. Marcela Nunez-Smith, who ensures that it's going to ensure that equality is at the core of every decision we make. That includes addressing vaccine hesitancy and building trust in communities, as well as fighting disinformation campaigns that are already underway. Above all, our plan is to restore public trust. We will make sure that scientists and public health experts will speak directly to you. That's why you're going to be hearing a lot more from Dr. Fauci again. Not from the president, but from the real, genuine experts and scientists. We're going to make sure they work free from political interference and they make decisions strictly based on science and healthcare alone. Science and health alone, not what the political consequences are. The Vice President Harris and I and our entire administration will always be honest and transparent with you about both the good news and the bad. We will level with you when we make a mistake. We'll straight up say what happened. And I said at the outset, the honest truth is we're still in a dark winter